Welcome to Unsung, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future, we're the now. I'm Dr. E, and in each episode, we'll uncover the untold stories of NPs across the country who are changing lives with their practices, making a real impact in their communities. And today's guest is KC Arnold, a trailblazing nurse practitioner and the founder of the Diabetes Center in Ocean Springs, Mississippi. KC has been practicing since 1997 and opened her clinic in 2005 after Hurricane Katrina forced the closure of her site. Rather than giving up, she built something stronger and better. And in 2012, she even built her own building from the ground up. With a laser focus on diabetes care, KC is changing lives every day and proving what's possible when NPs take the lead. KC, I'm so excited to have you on the West Podcast. Thank you for being here.
I'm so glad to be here. This is my first podcast, and I am so excited.
And I have a feeling, based on your personality, it's the first of many, many, many.
You're
so easy to talk to.
We'll see what happens after this one.
See if there's a PTSD after this one or not.
Yeah.
Okay, so as you know, Duet, this podcast is all about NPs who own their own practice. But before we get to the practice part, tell us what made you decide to become an NP.
So I've had a long history of nurses in the family. A lot of us have that history. My mother was a nurse. My older sister was a nurse. My mom raised 7 children and went from nursing as a, what was it called back in the day? St. Vincent's Hospital School of Nursing. Like a diploma nurse, and then she went on to get her bachelor's, and then she went on to get her master's, all with 7 kids, and she was a family nurse practitioner. And then my older sister was a nurse.
Your mom was a family nurse practitioner?
Yeah.
Hold a time out. Like, I need a timeline. Like, how long had the profession even been?
Not very long. And she worked as a nurse with the Pan Am. Actually, she did a lot of the medical stuff for the flying squadrons, met the pilots
like one of the
and the
first
stuff.
NPs in the country.
No, she's not. She wasn't that old, but God bless her. But I knew growing up that I was going to be a nurse. I graduated from high school, and the only thing I was going to do was go into nursing school at SUNY Binghamton, and I was going to be a Bachelor of Science nurse just from the get-go. And I knew during school that I was going to join the Air Force. So I had this plan for myself from growing up that, I did the volunteering. How many people even say they're candy stripers anymore? I was a candy striper at the hospital for years. I just knew that was going to be my plan. And my oldest sister was a nurse. She also went to St. Vincent's back, and that school's closed now in the city. So, but that was kind of my upbringing and wanting to be. That was my wannabe. I knew it.
So you knew you were a nurse, and you knew you were going to go for NP?
No. Growing up, I knew I was going to be a nurse because my mom didn't become a nurse practitioner till later on.
Ah, okay.
And my sister is a nurse midwife, and she's actually a doctorate in nurse midwifery now, which is one of the few programs for that too. So I just knew that I was going to be a nurse. That's what I knew. And the day I graduated from college in New York, I was sworn in to the Air Force on the day I graduated. And I waited a few weeks, and then I joined the Air Force. And the Air Force was going to be my career for nursing. That's what I knew.
That's it.
And my goal was I was a new grad, so they had a very nice internship program at the time for the Air Force. And my goal was just to see where the Air Force could bring me. And I had a career of working in the Azores, Portugal as a nurse. I worked 7 years in Germany. And then I came here to Keesler Air Force Base in Biloxi, Mississippi. And I can remember coming to Mississippi thinking, oh my gosh, I can handle this for 3 years. I'm driving up the base. It's pouring down rain. I have a son in the car. He's not even 1 yet. And my mom has helped drive me from my home state of New York down to Mississippi. And I just thought, what the heck am I doing
here?
Yeah. And
It's
the Air
crazy that
Force,
like you traveled the world, but what the heck was here in Mississippi?
listen, it was Keesler Air Force Base. So I get to Keesler, I'm gung ho, and I'm going to be I'm now a captain in the military. And then suddenly they had a drawdown and they didn't want so many nurses in the military.
Wait, I don't know
And
what a drawdown means.
a drawdown means that they're not going to promote as many nurses and they're going to ask us to leave. It's
Oh,
kind of like what's happening now with the government.
like
But I faced this
layoffs?
years ago. Yes, I faced this years ago at 12 and a half years as a career officer. I got served papers that had to get out in 6 months as a nurse, and I was not going to be able to stay in the military.
Hello, I have a
Um,
plan.
yeah, I had no plan.
You're
I had
messing up my
kind of
plan. This is my life plan.
Exactly. I kinda had seen the writing on the wall, and I had started NP school during that time because thank you to the Air Force, I became the diabetes educator of the facility,
Mm.
and that was my magic moment in nursing. I knew that that was my calling, and I was the diabetes educator for the facility. It was a wonderful position. I learned all about diabetes. And I looked around and I thought, well, I think I can help people with diabetes better than the endocrinologist I'm working with. And I decided to go back to school then and become a nurse practitioner only to focus on diabetes. So I was an adult acute care NP, but my whole mission, the only thing I could see was diabetes after I
Interesting.
graduated.
You know, it's really
And
interesting because in some countries when nurse practitioners, they don't have the same specialty we do. Some of them only have a track for diabetes.
oh God, I would
Yeah,
love
so,
that.
like, you're onto something, like, because it's such it's such a complex disease and so
It
many
is.
nuances. So
Yes.
to really specialize that, I mean, clearly endocrinology also specializes some of their time on that. So it's
And I speak
actually
to a lot
really
of other NPs who are both endocrine everything plus diabetes. I personally love the focus of just diabetes.
yeah, I think it's
Uh,
very forward thinking actually.
I just knew that that was my calling and that's what my gifts were going to be. And so I'm now told that I have to get out of the military. I'm going to finish up my NP degree in a year. So after I left the military, I had 1 year of schooling left, and I graduated as a nurse practitioner, and I started working in an endocrine practice not too far from my home in Gulfport.
Okay.
And I thought, well, this is wonderful. I've made I'm an NP. I'm doing diabetes. This is great. And then Hurricane Katrina hit.
Oh my goodness.
And so I was at the time, this is
Wait, and you're
19.
at that point working for someone else?
Yes, yes,
Okay,
and this
working
was
for a hospital or what?
a clinic.
Oh,
It was
clinic. Okay.
2005 in Gulfport. We were 2 clinics together. I was working in Ocean Springs at the time for my boss, and, August 28th was when the 2005 is when the hurricane hit, and, I mean, I was just doing everything I could. I had damage to my own home. I was a single mom. I had to ship my son out of the area
Oh goodness.
because, there was no school for about 6 weeks here. It was a really crazy time, and I'm volunteering at, centers to help people get their medicines and do whatever it took. And I felt like I was the, Hawkeye from MASH, like,
Yeah, I
"Oh,
remember
hey,
that show.
clinic, you got this, but I have this. Can I run this over to you, and can I have some of what you have?" It was just craziness, and it was a beautiful response from pharmaceutical companies. There's a lot to be learned from Katrina with the donations
Interesting.
of insulin that people needed and the clinics that we, set up to help write prescriptions for people to get them what they needed, because literally, I had patients that were up on their roofs for 4 hours, hanging on for life, and nothing was left in their home, or they couldn't use whatever was in the refrigerator because
Sure.
it floated. I mean, it was really a crazy time. And so I make it through the initial devastation of Hurricane Katrina, and I'm back at my office where my office in Ocean Springs was opened up, and my boss calls me up about 3 weeks after the storm and says, "Hey, 8:30 on a Monday morning, need to talk to you." "Yeah, what do you need?" She goes, "Well, we have some little changes. We're gonna close your clinic,
Oh geez.
and you can decide what you want to do." I said, "Well, what's my choices?" And she says, "Well, you can move to the main clinic, which is Gulfport, which now it's going to be a 2-hour drive one way because the bridges are out and the devastation, or you can be released from your contract. And I said, well, when do I need to make this decision by?
Just a little change. It's fine.
Yeah,
You
yeah.
won't even notice it.
She's
It's so small.
she said you have to make this by within the week. That was Monday. I had to tell her by Friday. And I literally hung up the phone with her and I started crying
Oh
because
my
it was
God.
just
Yeah.
too much with the devastation.
This is how you put
I
food on the table. I mean, come
Yeah,
on.
yeah. I'm a single mom still. Um, uh, I didn't know what I was going to do. And I had an NP student with me, and her name is Kathleen Williams, and she will be forever in my heart because that night she saw me fall apart and I, had to pull myself back together and see patients. I made the decision that night to go talk to one of my colleagues, Dr. Kristen Vergunt. She was an internal medicine nephrology. And I went to her and I said, hey, do you think you could help me out? I don't think I'm going to have a job. And could I work for you? And she says, no, you need to start your own clinic.
Love
And
her.
I
Love
said,
her.
what? What? I said, I wasn't even thinking about that. We're like in disaster recovery. She goes, no, you have what it takes to do your own. I'll be your collaborative physician. And I printed off the piece of paper. She signed it. This is 24 hours after being notified that I was about to lose my
Okay.
job.
Oh my God, I just got chills from the story. This is like universe intervention, divine intervention. It's women
I,
helping women. It's
yeah,
like check, check,
she was
check, check.
amazing.
I love
She
it.
was amazing.
Wait, you said something about the student. What happened with the student there?
She also had nothing left. Her house was totally obliterated with the storm. I go back to her the next right after meeting with Dr. Vergunst, and I said, I think I'm going to do my own clinic. I've got a tax ID number. I've got a collaborative physician. I'm going to do this. And she goes, hold on.
Yeah.
And she runs out to her car and she pulls out the book, The Business and Legal Guide to the Nurse Practitioner of Owning Your Own Practice
No
by,
way.
by Carolyn Buppert.
No way.
She had this book in her car because when she drove away from her house, she took her books with her because she's in school. She could at least study during all this craziness. But she handed me that book, and that became my Bible to opening up my own clinic in 3 weeks or less.
Oh my God. So wait, so she just happened to have it? She wasn't.
She ran away. She had to evacuate, and in her car, she took her books with her school books. It was a brilliant move,
Hey,
and there
this
was
is
no
like
way at that point that I could have gotten that book because there was no UPS,
yeah.
there was no
There was
mail
nothing.
service whatsoever, and she had
I
that
mean, if
book
there
in her
was
car.
ever a clear message,
Oh yeah,
it's like first of all, let's get you kicked out of your job because you weren't going to think about it
yes,
at all.
yes,
And then let's
exactly.
get you someone's like, "I'm
Yeah,
signing. Here's the book."
yeah,
I
yeah.
mean I mean, sometimes we're, like, looking for the message. This was
This
like,
was
"Hello."
this this was not in my plan.
This was
I
God's
swear
plan,
by
though,
that.
or universe's plan, whatever people believe in.
Yes, I really had no plan to do this, and we're in the middle of a devastation, and I'm like, I don't have a job. Let's do it. And
Wow.
the fact that these messages were happening to me all along the way in this little short few weeks period of time, I made a decision because now I had a plan. I had a collaborating physician, which
Didn't
I
even
didn't
think of
even go in.
getting.
No,
Yeah.
and I made a timeline of 3 weeks to get a place, get electronic health records, get whatever I needed to open up, and I did it. And November 1st, 2005 was my first day of opening up my own clinic. And it was me and one nurse. I hired one employee and one student, Kathleen Williams. She helped me out the first few weeks because there was nowhere for her
And
to
didn't
go.
everyone just need you? Like, how many everybody needed you.
Yeah, but it was still a very scary moment because I'm changing locations. I now, my first day, I had this many patients. I have to
Oh,
show that big
sis, I had
one.
0 on my first day, so 1 is amazing.
I had one, but I found out that my old clinic was running around to the old building and taking down my signs saying where we're at and how to call us. And once I
Wow,
found
so
that out,
petty, so
I,
petty.
I went back to my boss and I said, "Look,
What do you
you've released me for a contract, and this is devastation. And if you could at least give me the kindness of letting me try to start my business without trying to hinder me. And they finally did. They finally did do that. I was so thankful for that. Yeah.
And I'm glad you went and spoke to her because, like, it's harder, I think, to be mean when someone comes like, "Come on, I'm trying to put food on the table. I'm a single mom. Like, leave it alone. Put stop." So I'm glad that that she turned around. But that's
She did.
crazy. That's
They
crazy.
they, they
Good
just
for you
weren't
for
nice
talking
at
to her.
first.
Good for you for talking
Yeah,
to
and
her.
it was just nice to it didn't happen right away. It took me a little while to figure out what's going on. But once I figured out that they were trying to suppress my change and not share my information, they came around. But and
It's
they
so
weren't
funny.
even open yet.
I always say, oh, they weren't opening. I always say when I speak and motivate other people is like, when people are trying to push you down or suppress you, you know you're onto something.
I
That's how
just
you
didn't
know, that's like a litmus
feel
test. You're
that
like,
way at
okay,
the
I guess I
time.
should keep
No, that's
going.
so
Because if
true.
everyone's like, whatever, let her go, who cares? He probably, but
But those 3 weeks, I would never encourage any provider, any nurse practitioner to think about doing this in 3 weeks. But I spoke at on the West Coast. It was West Palm Beach. I forgot I spoke at National um, during those 3 weeks. I spoke my first time ever speaking nationally for diabetes. A meeting that I was supposed to speak at in for New Orleans in that same 3 weeks, what got moved to Miami, and then our state level conference was in those 3 weeks, and that got moved from the coast to Jackson. And I kept all those commitments
wow.
while I'm trying to get my business off the ground. Uh, but it was helpful because I didn't have time to really think about
Yeah,
things.
yeah, no time to focus. Let's just go.
Right. I had a little, let's do this, move on this, get business cards. Um, there was just so many things to think about, credentialing. And I learned how to do that myself. I mean,
Yeah.
I literally,
Which is
my,
which is actually, um, I know you're saying that's not what you recommend people to do, but it's
absolutely
actually
not.
exactly what I recommend people do because I tell people, "Don't overthink it. Just go." So in your case, I don't think you would have listened to that advice if I told you don't overthink it, but it
Hmm.
forced you not to overthink it. But I tell people all the time, there is no business plan. No one's gonna teach you. No one's coming. And the faster you move, the faster you start. So in a way, like, this force you to do all that. Like, some people want
Yeah.
to think about it, and they type it up, and then 2 weeks
Yeah.
like, you
Yeah.
just did it. So it's actually, I was gonna tell you, this is how everyone should do it. Everyone listen to this. Do the 3-week plan.
This is my binder from 20 years ago. I still
Wow.
keep this. And the whole I did have to get a uh a loan from a bank. We'll get into the finance stuff, but like, I don't know if you can see this. This is like my first little ad. Kathleen Williams took that
I'm
picture for me,
obsessed.
and that was my whole little ad for just starting out my practice. But
I'm
this was
obsessed. That is
this was
so
like my
cute.
little binder. Everywhere I went, I kept this. Like, okay, I'm working on this. I'm doing that. Okay, let me give this lecture. I'll be right back. And this was my little binder for 20 years. It's November 1st. It'll be 20 years ago.
God bless. I'm obsessed
Yeah.
that you still have that. That's so
Oh,
cool.
yeah. And then the other thing I still have, which let me show you that. Um,
This is it. This is the thing. Wow, be quiet. That's amazing.
I cannot recommend this book enough for someone who's thinking about opening up a practice as a nurse practitioner because and this is she's got more editions. I think she's up to the sixth or whatever, but it goes state by state. And so
Wow.
there's a general how to do it and what you got to think about, and then you flip into the state stuff. This and that binder I took everywhere with me for
I
three
love that
weeks.
story so much.
Yeah. I st-
How old was your son at the time?
oh, he was 13.
He was 13.
And what
So was he in the practice with you? Because my kids were in the practice with me when I first opened.
Of course.
Yeah.
Um, and he had some great ideas. There were a lot of disaster recovery issues that I couldn't get a phone. I applied for a phone, but it wasn't going to come for a while. And how do you communicate to patients when you don't have a phone? And my first location, I rented from the hospital. And that location happened to coincide with Dr. Vergunt's. It was a spot that I could use. So she allowed me to use her phones for maybe the first month,
Wow.
and at least to call patients and remind them of appointments and have a temporary number until I could get mine working. So that, having communication is key for any practice to get started. But because of the disaster recovery, any new lines was going to take a while. And so my son was working in my office and he said, Mom, your front desk is so far away from where you are. What 13 years old, why don't you use Facebook Messenger or something without private information like rep is here, your 9 o'clock got here.
Right.
It was his idea. We still use that today.
Love
Now,
that.
we use Teams now, a little more
Yeah, yeah.
secure, and we don't use any private information. But it was his idea on how we could communicate without walkie-talkies or craziness, because the way that initial setup was, we were quite a good there were doors between us, and we couldn't know who was here, and
That
that's
is
how we
so
communicated for a
great.
while.
I love
Yeah,
it.
and that was from a 13-year-old, yeah.
And there's
And
something
he
magical. I don't think I touched on that somewhere, but there's something magical that happens to the kids when they see their moms getting it together, like starting from scratch and then watching them grow up to be the success that you are. There is so impactful. Like, I know as moms, we kind of are like, oh my God, I'm not spending as much time, and the kid's here doing homework, and I should probably go take them to soccer. And so we're always torn. But
Yeah.
but the priceless experience of watching their moms get it done is so much more impactful than that soccer practice. And I don't think we give ourselves enough credit for how much that shapes them.
Well, I feel like sometimes he missed out on that part of me because I was so
'Cause you were
entrenched,
there. Yeah.
and
But he got
and
a
he
side of you that other
he
people.
didn't get to go to a lot of soccer practices,
I'm with
and
you. Me too.
there when he left for college, he came by my office and I kissed him goodbye, and he drove off to college in Nashville, 8 hours away by himself, because I at the time I couldn't take off to say goodbye to get him into college. I mean, I wish I could have been that parent, but
But it is your clinic that got
yeah,
him into college.
that's the truth.
It is your clinic that got him
Uh,
to college, and that's
That's
just how
true.
it is. And it's
Yeah,
a
no,
really and I
yeah.
wanna take a moment to acknowledge that in you because I don't think as moms we take that moment. So, I'm hearing your story. I also spent a significant amount of time as a single mom before my wife came into my life, and there is something magical when the kids see that. So I just wanna take a moment to acknowledge you. You
Yeah,
did a
yeah.
great job there. Amazing job.
Yeah, and the blessing is now I have more time to do that. So,
Right.
I have grandkids now, and I can focus on them, and I can help them more than I ever could have if I hadn't grown to this level of
100%.
owning my own practice, and
So, let's talk
I
about this
love
level.
that.
How many patients are you, managing? Like, how many patients are in your panel right now?
At the 7-year mark, I decided I need to expand. And I was renting from the hospital, and I ran around the community, and I found some locations that I could take and fix to be like rental properties for me. And then I found land. And then I said, I'm going to build. And I got a land and building contract with a builder, and I built my own building. And that was the change that just went like this to the practice,
Mm.
because I'm now in charge of the space. And I am now at the 7-year mark. It took me 1 year to get out of the red. Um, and I've never had a bad year since then.
That's
So
good 1
once
year to get out of the red.
1 year, I was on a mission, and and by being able now to open up my own building, I had control of what I could do in my property, which is, hospitals have all these rules and regs, and you can't always do things that you want to do on the property. So that really opened up a lot of things for me by adding on my own building. And then I hired another nurse practitioner, and then a year later I hired another. So now I've had this growth of hiring other NPs
Sure.
who were not experts in diabetes, but I made them into that.
Oh, so you
And
trained them.
it takes 1 year to become an expert in diabetes, and I'm working diligently with that person. And then every NP that I've had over these years, and some have changed because of another childbirth or
Sure,
change for
sure.
job opportunity, um, but at 1 year, they have to take the certification exam, board certified advanced diabetes management, because we are a diabetes clinic. And I want to say we are expert in diabetes management. And that's how we show that upon our other adult or family nurse practitioners. So that's what we all are. So there's 3 of us now, we've grown to, and each of us see anywhere from 16 to 18 patients a day. And that's slots. So a new patient could be 2 slots. A follow would be a 30-minute slot. And we have a little bit of over booking because of, people cancel, that kind of stuff, no shows. But that's our busyness of 3 NPs seeing about a total of close to 60 patients a day.
Amazing.
And
So the
that's
3 of
with,
you are there together.
yeah,
So like 20 each for the day.
yeah, yeah.
Amazing. What's your patient panel size at this point?
We're about 12 to 1,500 each. I'm probably a little higher. And then as
Yeah.
news come in, I would shift them to the other providers. And then when I get some openings, I can take some news too. I'm never close to news. But we do try to shift the new patients to them so that
So
they can
you
have that.
so you went from 1 patient to 1,500 times 3 providers in how many years?
At the 7-year mark, I couldn't keep up anymore.
At
So
7
that's
years
what,
from the new building. But when did you
yeah.
actually start?
In 2005 was the start of the clinic, November 1st, 2005. And in 2012 was when we built this building.
Amazing, amazing. So when you built the building, um, what was your patient panel size at this point? How many people we were seeing a day where you were like, I could do this?
Um, this number, same number.
Oh, you
It's
were at
just
1,500 at that point.
yeah, yeah,
Okay,
yeah. And
great.
I knew that the capacity, I couldn't keep up anymore. So that's why I decided to build a building. And then we just finished in July. I added on another 2,000 square feet. So now we have a room for 2 nurses. We have for individual training, we have an education classroom. We have an infusion center to do the
Nice.
new medication called Tzield, which delays the onset for type 1 diabetes. So we have this whole new area, but we that never key thing is we grew slowly. I
Mm.
I I didn't have all of this when I started, and I just built on to it slowly, and didn't really have this vision for this huge one place for everything here for education. But
It
I
just
knew
came.
that was going to be my goal, I grew it slowly, and
Oh
that's
my
really a key
God.
thing. Is not to get all this real estate thinking that you will fill it. I filled it, and then I expanded, and then I filled it again, and I expanded. So
Oh,
that's
I
kind of
love that
how I
idea.
view that.
Oh,
Uh,
that's a nice tidbit. So what's your
Yes, it
day
was.
to day like? What's a typical day for you now?
I am 8 to 5. We
Monday through
close for
Friday?
lunch. Yeah, 8 to 12 on Friday. We close for lunch. It is very important to me as a business owner that my staff get to break as well.
Yeah,
So the door is locked at 12. We reopen at 1.
yeah,
It closes at 5. And we really do try, unless there's an emergency, a severe hypoglycemia or something
sure.
happens. But most of the time, uh, 5 o'clock, the staff is out of here. And at lunch, we all take a break. And there's plenty of space here. We have a nice employee kitchen. We can sit and listen to a lecture or talk, have lunches together. And I always start the day. This is my military upbringing with a briefing. That's how you do a flight thing for the military. And so we start with a 5-minute briefing. Who's working today? Who's doing what? Do we have lunch scheduled? Do I have any scheduling things? So everybody kind of knows what the day is about to become.
Yeah.
And they knew that today I was going to have this podcast and we had to be on time. So
I love
th-
that so
those
much. So
those
that's a
it's
good
nice.
habit. That's a great habit.
It,
Our office does wins. We start with wins and we end with wins.
I like
Um,
that too. I need to write that down.
yeah.
Okay, good.
It also is an opportunity for us to kind of, get to know each other, especially when somebody's new, but just also helps center us around positivity. But
Yeah,
I like yours as well, so we could both adopt each other's, which is why I
yeah,
like to share these tips because everyone has such wonderful ideas. So,
yeah.
what would you say is like the one habit or system that you've implemented that's really been a game changer for your productivity?
Number one is co-training.
Mm.
My medical assistant can be a receptionist, and my receptionist can be a medical
Oh,
assistant.
okay, gotcha.
Not
Nice.
full time, but they all know how to take somebody back, get some vital signs, open a note, the basics. Because I've been open for 20 years. I've been through COVID and I left my entire staff open. I never closed down one day for COVID because we were ready to, if somebody was sick, we could change and help each other out. So it's the teamwork that is so important, and they know each other's roles. And I think that is key for getting a team to work together so that I'm a receptionist. I can't do that. No,
Right,
wait,
right,
I'm a
right,
med,
right.
right. So
That's a
they
big
can
deal.
all take,
Yeah.
I think that is a key thing in a small practice, is that everybody gets to know the other person's role. Now, they can't do a nursing role, they can't do an NP role, but anything that is supportive staff, they know how to do it together.
That's
They,
actually really important. Cross training is really important. It's a good tip. I don't think anyone brought that up. It's something that we also do because you need to be able to manage when someone calls out.
yes, when you have a small staff, or
Small
12,
staff, you don't have
small
400
staff, right,
people.
right.
That's a really, really solid point. I don't think anyone brought that up. I love that one so much.
Yeah,
Um,
it's been key for me, and I've kept it going the entire time. And I hire somebody. I'm going to hire you to be a receptionist, but please know, once you feel comfortable in that role, we will train you on just how to bring a patient back. We're not expecting you to be a medical assistant all the
sure,
time, but we do want you to at least know how to bring someone back. That's really important, and that helps when you're. I think the key to having a specialty is being quick to make changes. And I don't have a board to go over. I can make a decision today and say, I
sure.
really like that idea. I was at a business meeting, a pharmaceutical dinner 2 weeks ago, and I learned about an AI medical assistant that can take the charting right before the day and pull in any cloud based data for that patient and put it into the note. I'm signed up. I'm waiting to see implement, and that was 2 weeks ago. So, I think those are key strategies, is when you hear something that could help your practice and make you more efficient, that you look into that technology and see if it can help your practice. And then having a staff that's like, "Okay, here she comes again."
Yeah,
But
absolutely.
they're all excited about that because they know I'm trying to make their job more efficient and easier. And that is one of our cogs in the wheel that slows things up when we're trying to gather that data and get the patient back in a timely manner. So we have about 10 minutes of checking the patient in and getting their copays and making sure we get their glucose meter, their sensor data, their insulin pump. That's a lot. And so finding strategies that you can quickly. Speed is really important when it comes to.
Workflow is so important.
Yes, and
Yeah.
so we're implementing that. I'm waiting for that call as we speak to try to get that um, that into integrated into our practice.
Oh, I love
And I
that so
think
much for you. Yeah.
I think the other thing is, whether you're primary care or your specialty, being open to things that could help your patients. And so I focus on diabetes. Yes, I do. My patient came to me and said, "Casey, are you going to prescribe certify for medical cannabis?" I said, "Well, I'm a diabetes nurse practitioner. Why would I do that?" And he almost said stupid, but he didn't use that word. Because in Mississippi, it's approved for diabetic peripheral neuropathy.
Neuropathy, sure.
I will get on that tomorrow. And I became a certified person for medical cannabis. We added that into our flow. I have slots every day that can take an add on, because those are things that people kind of want to get into that process quickly.
Sure.
I also do commercial driver's license medical exams. Why would a
Why
diabetes
not?
nurse practitioner? To
Absolutely.
keep my patients with diabetes in gainful employment
Sure.
and keep their insurance.
Sure.
And now with the insulin, they can do that. And we know how to do that very efficiently, to get their diabetes assessment done and then to do that. So those are some of the things along the way. I'm like, oh, that's a great idea. But we had the speed to try to get that change into, because my staff, it's like a key strategy of, please expect change here.
Yes. I love
Uh,
that. I love that so much. So as we get towards the top of this hour here, because I know your story, there's so many more details to your story, but
or I can talk.
our time is our time. What's one of the best pieces of advice you've ever received about running your own practice?
So the best piece of advice, I had driven up 3 hours north to get donated equipment for a clinic to after the Katrina, a nurse practitioner was closing her clinic, and I go and I'm bringing her equipment down here to a facility to help the community for the recovery of the hurricane. And as I'm gathering the stuff, I'm like, I'm about to open up my own clinic. Do you have any words of advice for me? She goes, "Oh yeah," and she looks at me. She says, "Don't get a conventional loan." I said, "Oh,
Oh, okay. Say more.
so when you get a big loan, you have to start paying on that right away."
Sure.
And so the way I financed my practice, which I don't recommend, but it's what I did, I took a HELOC, a home equity line of credit,
Mm,
for $75,000. And I used little bits of that to pay my nurse, to keep me afloat, to get things started till the money started coming in.
interesting.
I took a loan on my equipment, my computers, my a few pieces of equipment that I need, and the software, and that was about maybe $50,000. But I didn't have this big loan to start with, and that saved me in the end because
Sure.
I was able to pay off that equipment loan by the first year, and the HELOC. Once the money started rolling in, I didn't take any more money from the HELOC, and then I could pay that off. So that was my strategy that first year, taking a line of credit, whatever that would be for you, was a lifeline for me in starting a clinic.
Oh, I love that. That's a great piece of information because you're right. You don't have to pay it right away. You don't get hit with this amazing.
Yeah, and
Yeah.
you need funds to get started
You need
unless you
funds to get
have,
started.
you
So
know.
what are your goals for your practice in the future?
So my big dream once I added this practice, the extra addition was to have a diabetes education center, and we are
Ooh,
a ADCES recognized diabetes education clinic, and we've been that way for almost a year now. That was my big
for
goal
patients or for other providers?
for patients.
Nice.
So now that I have this large area, we're talking to my state level nursing association. Do you want to do any programs or classes down here? Is there anything we could do? I own the space. I can do whatever I want with it. So it's really nice to have these options that I can do something else with my space on the days that I'm not seeing patients and we're not busy with patient care. So I can do a lot with that space, and that's really a benefit, and I see a future of me offering other things for the community here in my
Oh, like a
clinic.
community center. That's so nice.
Yes, yes. To be able to offer, we've done some already. We've done a few things, little things. Like I had a nursing dinner for um, to meet the state legislators. I pay for the dinner. We invite the legislators, and 20 or so nurses from the community come have dinner, and they eat with the legislator, and we have a little talk about the goals for nursing in the state. Very helpful. I've done that for a couple
Oh,
years in
I
a row
love
now,
that so
but I
much.
have the space to do it now. That's much
Yeah.
nicer
So
than I used to have.
so nice to
So I,
utilize
I
the
think
space.
for using it, and then the other thing is I'm getting up there in age. I'm 63, and I see myself working probably for the next 6 to 7 years. My goal is to make this sustainable, and is to find another nurse practitioner that would want to take this on and me be a consultant and help them to keep this going. Or if they feel like they got it, they got it. However they want to do that. But I'm trying to find the right mix of NPs that would make that easy.
Mm.
And whether I just stay as a consultant 5, 6, 7 years from now, or they would take it over. I'm open to those options,
Oh,
but I
that's
don't
you
want to
heard it here,
see.
folks. If you're looking for a diabetes practice, this is where to go.
I'm going. Yeah, you want to have a growth, and you don't want everything that you've worked for um, to fall apart if you retire. So my goal is a transition in 6 to 7 years from now, and I'm like at the 5 year mark, I'm going to get really serious about this. But I'm just thinking about what can I do? What
I
do
love
I
that.
get? I don't have I don't have a true business manager. I pretty much do a lot. I have a biller, but I do a lot of the HR stuff, and I've liked and the funds handling, because for 20 years I've seen other practices go down because of money issues. I've mentored a lot of NPs who, over the years, I want to help people. If someone comes to me and wants advice about that's why I want to do this. I want to speak at conferences. I want to share my experience and encourage other NPs to take that step out there and to build a practice. But you've got to do it financially sound. You've got to have checks and
Sure,
balances in
absolutely.
where the money's coming in. And I chose not to hire an office manager. That's what, because we're small. If it gets much bigger, I probably will have to get one.
I
But right now, and I have a
so
half a day as admin built into my schedule. Fridays are my admin day. It also can be a pop off valve if there's a teenager or a child that has to get in right away. We
yeah,
have some, there are some times where we've got to help somebody today.
of
It's
course.
at a, yeah.
So, wrapping up on, I already kind of know on this last one, I got a little hint before we started, but we talked a lot about the business, but we need to know a little bit something about Casey. So, I'm going to ask you two questions.
Okay.
One, if you weren't an NP, what would you be doing?
You ready?
Ready.
Didi? Up here. It would be, I don't know
Oh,
if you can see her. It would be
what?
dog trainer.
Hello.
I have
Hello.
pet therapy in my clinic, and Dee Dee's my afternoon dog. And these dogs are trained to give loving to my patients. And I
Wow.
love training dogs. I am also a volunteer puppy raiser for guide dogs called Dogs Inc. And she is a flunked out guide dog.
She's a
She
flunked
did.
out? Why did she flunk out?
She had a distraction issue, but she's here. I have a morning dog and an afternoon
Oh,
dog.
that sounds like a
They
perfect dog for me, distraction issue.
Yeah, yeah, she's the career change dog that didn't make it. She, also is trained as an arson dog, but she didn't make
Wow.
the program. I raised her as a puppy. I'm a volunteer for this school,
Oh my
and
God.
both of my dogs and I'm a pet partners, evaluator here. I do that on a every other month basis. We do evaluations here in the clinic to evaluate other teams for the community, that they're safe and that their animal teams are cohesive for being out in the public.
Oh
Yeah.
my God.
So
So amazing. So
so
amazing.
that's my plan for retirement is to
That
do more
that's a great
dog
plan. You're
training.
one of the few people I know who have a great plan. That is amazing. Okay, what's a fun and surprising fact that most patients or colleagues don't know about you?
So I sing. I have an
Oh,
Irish band, and
you
I play
sing?
in church, and I'm learning to play the drums. I march in a Scottish band,
Oh
a
my
marching band.
God. I love
Uh,
this.
And I figured if I started learning drumming now, I mean, I'm snare drum and I've got the kilt and the hat and the harness and everything. If I started learning now, maybe by 3 years from now, I'd be good.
Yeah, I mean,
It's not an easy thing.
that's how long it takes to learn a skill, I feel like, at our
Yeah,
age. It's
yeah.
like,
I've been very musical all my life, and more
oh,
people know me as the girl who sings in church than the nurse practitioner that
oh
owns
my
a
God, I love
diabetes
that.
clinic.
I love that
So
so much.
many people are very surprised by that.
That is so beautiful. I love that so
Exposure.
much. I love that so much. Okay,
Yeah.
so Casey, the diabetic educator, the dog whisperer, and the drummer and the singer.
Yeah.
What is the last message you want to give our audience?
I think anybody who's considering owning their own practice, just to follow their passion of what they want to. My passion is diabetes, and I've grown an entire practice based on that passion. And every day, I'm never like, oh, I got to go to work. I
Yeah.
love doing what I do every single day. And what gives me probably the most joy in what I do is taking someone with a very high A1C and a very poor quality of life and bringing them down to an A1C of 6.5, and they've lost 20 pounds. And I've got to take their picture again because they look so much better now to
Wow.
see their life and their health change over a period of time. It's not
Sure.
not
Not
quick,
magic.
but with the tools we have today with the GLP-1s and the GIPs and the SGLT2 inhibitors, all the tools we have for helping a person with type 2 diabetes, it is just amazing to me what we can do to help people have healthier lives. And that's the joy of what I do. Does everybody want to listen to what I say or want to go to my diabetes education program? No, but at least I've offered. And I think it's giving people those choices and taking that passion of what you do and make it happen in your community. That is what is the beauty of what we do as nurse practitioners.
I love that so much. Ah, KC Arnold. What a great podcast.
Oh, thank you for
Thank
listening.
you.
And I really enjoyed the
Are you kidding me?
conversation.
Everyone's
And
going to listen to this. This was great. I was at the edge of my seat.
oh,
Um, thank you for being here with us today.
thank you.
Of course. It was a pleasure. Well, that's a wrap for today's episode of Unsung. If this inspired you, share it with another MP who needs to hear it. Don't forget to subscribe and leave a review. It helps more MPs find us and fuels the movement. Want to join the largest MP practice network? Learn more about Duet on our website, joinduet.com. Until next time, keep pushing boundaries and proving what MPs can do.